what's your mindset when you prepare for a surgery?
So, before we plan on doing any operation, the most critical thing is to prepare well for the operation before you actually go into the operating room. And a lot of it depends on the complexity of the operation that you're going to do in terms of how much pre-preparation you need. But perhaps I could give you an example of one of the most complex operations that we would prepare for, and then we can go into perhaps some of the simpler ones. So I don't know if you can see it on the camera, but on the wall there are two sets of conjoined twins that I've separated in the last few years, and these are babies that are born that are joined. In the case of the upper panel there, they're joined at the vertebral column and the buttock area, and in the case of these lower babies, they're joined at the chest and the abdomen. So these are incredibly complex patients that take months and months of preparation before you ever get into the operating room. And in order to do an operation of that magnitude, you have to convene different groups of surgeons and assistants that can help with this very, very complex operation of separation of the twins that you are preparing for. So for example, in the babies above that were joined at the vertebral column, you needed the help of the neurosurgeons and some other surgical specialists. In the case of the babies that are joined at the chest, you needed the help of the cardiac surgeons. And all of these babies will need assistance from critical care physicians, from critical care nurses, and you know, these are teams of perhaps 20 to 30 individuals that you convene on the day of the operation in order to be prepared to go into the operating room to do this 12 to 15-hour operation. And actually, it's so complicated that before you even go into the operating room, you convene all of these individuals beforehand, and we took dolls and we sewed the dolls together in the area that where the babies were joined in, and we actually practiced with these dolls in the operating room so that we would walk through all the steps of the operation a few days before the actual surgery, so that you could try to figure out any complications that might arise that you can think about beforehand. So as you can imagine, those kinds of operations take months of preparation. A simple operation, for example, a hernia repair, we've done so many hundreds or thousands of them that you don't really have to do that much preoperative preparation, but you do have to make sure that the baby is in perfect condition for the operation, that everything is prepared the day of surgery so that everything will go smoothly with no problems.
Cool. Do you have a specific regimen when preparing for a surgical procedure?
Again, it depends on the complexity of the operation. So some operations are extremely rare, and perhaps we've only done few of them during our careers, but the components of the operation we're probably very, very familiar with, because we do it on a much more regular basis. So if it's something that's more rare, we might have to read about it, we might have to pull many articles about it, we might have to work with our librarians to pull articles about how other people have done the operation so that we could read and learn from other people's experiences. So if it's rare and it's unusual, it takes a lot of beforehand preparation. If it's common and we do many of them each week, then it takes less preparation because we know exactly what we're going to do.
How do you reassure patients that they're going to be fine before a surgery since they're so young?
So that's a great question, and often if it's a very young patient, it's more important to reassure the family that everything is going to be okay than to reassure the patient, because many of our patients are so young that they don't understand anything that we're talking about. And a lot of it is explaining what you're going to do so that they understand every step of what's going to happen to their child. We sometimes bring the parents and the patient in beforehand to look at the operating room area and to become familiar with the area. And then we've done something really neat on the day of the operation. And in order to alleviate stress, because all the patients, if they're old enough, are going to be nervous, and all the parents are going to be nervous, because it's not your typical, thing to have your child undergo surgery. So we've created something in the operating room called the ocean room. The operating room is OR and the ocean room is OR. So we tell these patients that they're going to go to the ocean room. And what the ocean room is it's a fabulous big toy store. And we built it down in the operating room. And before surgery, while we're getting the patient ready, every patient gets to go to the ocean room and pick a toy. And many of the toys have an ocean theme. water, water animals and things like that, or anything related to water, and other toys as well. And so every single child who's going to have surgery gets to go to.
Tell me the cons again of becoming a pediatric surgeon.
Well, I can't say that there's any cons of becoming a pediatric surgeon, but there are challenges. First of all, you have to be really committed to your patient. So it's going to take a tremendous amount of time away from some of the other things that you might, want to have as part of your life. But it doesn't mean that you can't have it all. You can. I mean, you can be a pediatric surgeon. You can see patients. You could do research. A lot of what I do is research, actually. In the laboratory. You can have a family. I'm married. I have 2 children of my own. So I'm not trying to say that it's easy, but if one is willing to work hard enough, one can be successful. But I think you have to have a really realistic expectation of what it's going to take to accomplish this. And you have to, I think, be very well organized. And as I said, just get a lot of good advice from people that have already attained the position that you're thinking of going into, so that they can counsel you and give you advice as to how you can achieve your goals along the way. And you want to not only involve yourself with surgeons, but particularly you want to involve yourself with pediatric surgeons, so that because they're the ones that are the most knowledgeable of what it would take to actually be a pediatric surgeon. When you're thinking of going to medical school, it would be really important to try to go to an academic type of a medical school, and you definitely want to match in a general surgery program that is academic in nature and has a pediatric surgical component to it, because that will increase your chances of eventually matching in pediatric surgery. But these are all pieces of advice that people will give you along the way if you seek out the proper counseling. So it's really crucial to seek out the proper counseling as you get closer to those critical years when you're thinking about matching in general surgery. Because to be a pediatric surgeon, which is a 2-year fellowship, you first have to do a 5-year general surgery fellowship. So surround yourself by pediatric surgeons that can give you good advice.